One of the biggest public health issues in the United States and across the world today is diabetes. Hi, I'm Shireen. Diabetes mellitus is a group of diseases in which the body doesn't produce enough insulin or doesn't use it effectively. Essentially, this results in the blood glucose or blood sugar going up, leading to systemic and visual problems. There are two main types of diabetes, type 1 and type 2. Type 1 is 5 to 10% of all cases, and type 2 is more common, about 90 to 95%. Type 1 is usually younger onset with an autoimmune and genetic component. Type 2 is usually later onset and linked to diet, age, family history, and race, among other factors. However, both types can have visual complications. As a student doctor, I did a mission trip in Peru and my rotations in Florida, Jamaica, Alberta, British Columbia, and Ontario. I saw diabetes and its effects on the eyes on a weekly, if not daily basis. The prevalence of diabetes has been increasing not only in North America, but globally. Many people are surprised that diabetes can affect the eyes. The prevalence and lack of information on this public health issue makes it important for optometrists to tackle. There are a few things I ask every patient during my eye exam: their type and duration of diabetes, last A1C or blood sugar measurement, and how they manage their diabetes. It is important that I inform patients about the effects of diabetes on their eyes. Some of the ocular implications include diabetic retinopathy, cataracts, glaucoma, optic neuropathy, and corneal changes. These can present with nonspecific symptoms such as increased night glare, blurry vision, vision loss, or irreversible blindness. Diabetic retinopathy is the leading cause of blindness worldwide. In diabetic retinopathy, blood vessels of the retina exhibit characteristic changes such as cotton wool spots, dot blot hemorrhages, or neovascularization. These changes can put the patient at an increased risk for vision loss. Our role as optometrists is to find these changes early during our eye exams and prevent them from worsening. Now, how do we do that? Before I can educate my patients and the public, I have to stay up to date with the newest research in diabetes, especially in reference to ocular events. Peer-reviewed research articles and optometry news websites are a great source of information. Patient education, especially in the context of diabetes, is a multidisciplinary effort. Collaboration with the patient's family doctor, endocrinologist, and ophthalmologist ensures excellent and timely management of the patient. Relaying my knowledge to the patient and making recommendations for the patient's unique lifestyle and visual health is an important part of the eye exam. In addition to regular eye and health exams, medication compliance, good glycemic control, a well-balanced diet, and exercise regimen is important for optimal visual and systemic health. But my responsibility doesn't end in the exam chair. In an ever-globalizing and interconnected North America, I can extend my reach. Prevention is the best way to combat the ever-increasing rates of diabetes, especially when it is linked to lifestyle choices, and that can only be done through education. I can continue to interact with the public outside of the exam room with educational outreach programs at schools and universities, with contributions to social media, and continued collaborations with other healthcare professionals. By continuing the conversation, this ensures that our message is heard by many. Diabetes is a group of diseases that can have many implications on the eyes, which we as optometrists can monitor, prevent, and educate our patients about. Together, optometry can make a difference in what the world knows about diabetes. Thanks for watching this video. Follow me on Instagram to learn more.